Breaking news, there's a new virus called the Ebola virus, which is causing many people to die. Here's Paola with more information.
Thank you, Michelle. I'm Paola, your newscaster for today, and I'm here to tell you about the recent outbreak on Ebola virus disease, EVD, formerly known as Ebola hemorrhagic fever. According to CDC, EVD began in Guinea on December 2013, and with that, making its way to other African nations. EVD was not discovered until March 2014 after it had spread to 3 other African nations known as Sierra Leone, Liberia, and Nigeria. Ebola is a rare and deadly disease that first appeared in 1976 and was named after the Ebola River in Zaire. To learn more about Ebola, I have Dr. Desiree Phillips to explain what it is and how to treat it. Here's Dr. Desiree Phillips with more information. So here we have Dr. Desiree Phillips. So Ms. Phillips, can you please explain to us what exactly is Ebola?
Well, the Ebola is a rare but deadly virus that causes bleeding inside and outside the body. As the virus spreads through the body, it damages the immune system and also damages the organs.
What are some symptoms that can occur when a person is infected with this disease?
Well, according to CDC, the symptoms of Ebola is a high fever, a severe headaches, muscle pains, weakness, vomiting, abdominal pain, and lack of appetite.
Is there a possible cure to this disease? And if so, how can we treat it?
Well, for our employees, we practice hygiene, avoid contact with bloods and bloody fluids. We use masks. And if you're trying to travel, it's best to avoid funerals that require handling the body of someone who has died from Ebola. Avoid contact with bats and non-human primates or blood. Avoid hospitals where the patients that are being treated with Ebola. And if you return, monitor your health, and if you start seeing symptoms, start seeking medical attention.
How can you possibly be infected with Ebola?
You can get the Ebola virus by being around sick patients, infected animals, and objects like that's been contaminated.
Okay, well then, thank you very much, Ms. Desiree Phillips. Many people aren't aware of what Ebola really is, but here we have Michelle with Mr. Clamper to tell us his knowledge and what he believes to know about Ebola.
But do you know what this virus is?
Yes, it causes a horrific hemorrhagic fever. Approximately 80% of people die with supportive care. The symptoms start with flu-like symptoms. Then you begin to pour blood and other fluid out of every body opening. Every body opening. It's not good. And it's better not to come into contact with the fluid from people's body openings, or you can contract the disease as well. Please, please, listen to what I'm telling you.
Are you scared of Are you scared of contacting this virus, or?
No, I just try not to touch people that are spewing blood and other fluids from all their body openings at the same time. It's just simple. Just don't do that. Don't touch people.
Okay, thank you.
You're welcome. Bye-bye.
Bye-bye.
Very much, Michelle and Mr. Clamper. Now we'll take it to Maria to show us and give us a little more information about the statistics she has about Ebola.
To CDC News, ever since the Ebola virus started infecting people, there have been over 1,201 cases in the Republic of Congo. Of those cases, 946 people have died since 1976, and now in 2014 with the outbreak, there have been over 1,134 cases and 622 deaths. When getting this virus, it acts very fast, so after getting this virus, you will live approximately 8 to 10 days and then die. Now, back to Paola.
Thank you, Maria. So now let's go to Michelle so she can give us information about some traveling notice. Here's Michelle.
Virus. Travelers can be infected if they come into contact with blood or body fluids from someone who is ill or who has died from this virus. Notice, while traveling to an infected area, be cautious of what you eat because you can catch Ebola by eating raw meat from an infected animal. Here are some tips to keep healthy while traveling. Practice careful hygiene, avoid any blood contact of any kind. Wash hands at all times. Do not handle items that may have came in contact with an infected person. Avoid contact with animals and raw meat. If by any means you start having any symptoms, seek medical care immediately. This disease cannot be passed airborne, so traveling on the airplane may not be that risk because you can't risk it, but just avoid any blood contact and they have developed a travel and transport task force to keep everybody safe in order for them to travel to an affected area.
Concludes our newscast for today. Thank you for watching, and ladies and gentlemen, please do not get infected. Bye bye.
Hi. Oh shit. Breaking news. There's a new virus called Ebola.
Virus Badeli. I don't know why.
I'm still filming, you know that, right?
Stop.
Ever since CDC. Oh my god.